Okay, here's another question. Who needs a trauma kit? This question to me is mind-boggling. If you live in the real world, and if you drive a car, a motorcycle, a bicycle, if you have a home, if you're at work, you can be injured. How many people at the Boston Marathon ever gave any thought to having a trauma kit? You don't know. Active shootings at the mall, at the airport. You don't know. But let's just take the most basic, your automobile. If you drive in a car, you're hurling down the road in thousands of pounds of metal, and you can crash. If you don't carry the trauma kit for yourself, then what about your passengers? What about other people? Who needs a trauma kit? You do. It takes no time to learn to use the trauma kit to address the most common causes of accidental death. And that would be blood loss from the extremities and shock. Those are two of the biggest killers that are most preventable. Learn how to deal with it. I don't teach first aid, but I highly suggest you learn some sort of trauma care. Learn the ABCs, airway, breathing, circulation. Learn what a recovery position is. Learn how to treat for shock. Learn when to use direct pressure, how to pack a wound, when to apply a tourniquet. It's not difficult if you go and look. If you want to read about it, go to firstaidanywhere.com. If you need visual help, there's a website you can go to, skinnymedic.com. He has YouTube. You can look at trauma. You're only limited by your skill. But what you need to know are basics. Only you can take that and learn that. The White House came out with the Stop the Bleed program. The average person, everybody should have the ability to be a first responder. They have what's called the BECON program, and that's the National Association of Emergency Medical Technicians. BECON, blood control, where you learn to stop bleeding, identify wounds. You're going to be in situations, if it's internal bleeding, injuries to the chest, there's nothing you can do. Absolutely nothing but treat shock, keep the person warm. If it requires surgery, you're obviously not a surgeon. You need to learn how to prioritize an injury. When someone is hurt and there is no bleeding, but they are injured, you need to get them to help. You need to get them to an emergency room. But you need to learn what to do and when to do it. I'm going to give you an example of an accident I came on years ago. There was a child laying on the side of the road and several people gathered around. And people feel compelled to help. And as we got there, a lady was reaching over, and I noticed the child had a sliver of glass sticking out of his eye. And he was unconscious, but he was alive. And the woman was going to remove the glass. Well, we stopped her, but she felt compelled to do something. She said the glass had to be removed, and we stopped, and we covered the eye with a cup and kept the glass in place and waited beside the child until an ambulance got there. In another case, a woman was missing part of her wrist, but there was no bleeding. The skin was completely removed for about 6 inches on the inside of her arm, and yet the gentleman at the scene was going to apply a tourniquet because he could see the veins. You need to know what you're doing. If you don't know what you're doing, don't do anything. In any accident situation, any scenario, when you arrive, whether you're a part of it, whether you saw it, or whether you just come up on an accident scene, the first thing you do in any accident is you need to determine if it's safe for you to do anything. Does the person need to be moved? Can they be moved? Do you need to block traffic? Do you need to secure the area? The first thing you have to do is ensure the safety of you and the bystanders and the accident victim. Remember, this person is not your patient. This person is a victim, an accident victim.